First order of business is H.R. 7513, the Protecting America's Seniors Access to Care Act. I'm pleased to recognize the gentlewoman from Minnesota, Ms. Fischbach, for an opening statement.
Thank you, Mr. Chair. And before I begin, I want to submit a letter into the record without objection that was sent to Chairman Smith and Ranking Member Neal that has more than 1,000 signatures representing most, if not all, the state nursing home associations, both for-profit and nonprofit, and asking members to support this bill.
Without objection.
Thank you, Mr. Chair. And I'm honored to speak in support of the 1,000 signers of the letter and of my legislation. The Protecting America's Seniors Access to Care Act, which would defend nursing homes across the country, especially those in rural and underserved areas, and the vulnerable communities that depend on them. Most of us are acutely aware of the severe workforce shortages that continue to affect nursing homes. And the Secretary agreed that when he testified before the committee last year, this is especially apparent in rural communities like those in my Western Minnesota district. These facilities are already struggling to maintain their staffing levels and have an even harder time finding new staff to fill positions. But the Biden administration simply does not understand the problem, which comes as no surprise, since they do not understand rural America. Last year, the Centers for Medicare and Medicaid Services released Biden's one-size-fits-all staffing mandate for nursing homes. The mandate would require nursing homes in rural America to hire thousands of new employees. The problem is these employees do not exist. And even though the mandate is delayed for rural areas, it is highly unlikely the staffing crisis will be magically solved within a few years when this goes into effect. This mandate would do nothing to solve the ongoing staffing crisis, but rather would likely cause nursing homes to put seniors on waiting lists as nursing homes lower their resident count to become compliant with the mandate. It would even force some small town nursing homes to close altogether, leaving residents in rural areas with no options or only options that take them far away from their family, their friends, and the lives they know. All of us want the highest quality care for everyone in nursing homes, but a one-size-fits-all mandate does not achieve that goal. Instead, CMS should work with the stakeholders, work with the actual caregivers to find a solution that focuses on boosting the recruitment and retention of qualified nursing professionals. This is the strategy 31 of my colleagues and I recommended in a letter to the CMS administrator last year. In August, I was hopeful CMS would change this rule on their own, after their own report stated that there was no single staffing level that would guarantee quality care. Unfortunately, even with the evidence that a one-size-fits-all plan will not improve quality care, the agency took down the accidentally released report and continued with its plan. The Protecting America's Seniors Access to Care Act is simple. It stops CMS from implementing this misguided rule. What this administration and many of my colleagues on the left do not understand that if these doors close in rural America, there is no other option. This all or nothing plan is going to do more harm than good. CMS needs to remember that rural communities are different than urban communities, but are no less important, and they need to hear from all the stakeholders to come up with a solution. I thank you, Mr. Chair. I urge support for the bill, and I yield back.